My name is Chris Sadler. I'm a physician assistant in endocrine practice out in La Jolla, California. I'm here at the Meds East Conference, and one of the topics I'm speaking on is thyroiditis. Thyroiditis is a condition where there's inflammation of the thyroid gland and a rapid release of stored up thyroid hormone into the bloodstream. It can present as hyperthyroidism, but it also can present in a different phase as hypothyroidism. So your index of suspicion should be high for thyroiditis, especially if someone has a tender thyroid gland. But a lot of patients present with silent thyroiditis, so there's no tenderness to the gland. So things you have to look for are, do they have the classic signs of overactive thyroid like Graves' disease? Do they have bulging eyes? Do they have a very large goiter? If you don't see those things, then you should be a high index of suspicion as maybe this is thyroiditis. So if it's not obvious from physical exam or from labs, how can you differentiate? A thyroid uptake and scan is very helpful in this instance. The thyroid gland needs thyroid hormone to make, it needs iodine to make thyroid hormone. So if you have an overactive gland that's producing too much thyroid hormone, you'll see a rapid uptake of iodine on a scan. However, if you have thyroiditis and there's inflammation or injury to the gland from this destructive process, you'll actually see virtually no uptake of iodine in the gland, so the scan will look virtually blank. So that can really help you to differentiate between the two. Now, treatment for thyroiditis is primarily symptomatic. So you're really trying to treat the symptoms of the hyperthyroidism, or if they're in the hypothyroid phase, you're treating the symptoms of hypothyroidism. If it's severe, you can give them a thyroid hormone for a short period of time. The good news is most cases of thyroiditis resolve over time and it's self-limiting. However, you have to follow these patients along because some of the patients will actually go on to develop overt and continue to be hypothyroid. You typically have three phases of thyroiditis. You basically have a hyperthyroid phase right when the gland is injured or inflamed and you have a release of thyroid hormone. And then the gland goes into recovery phase where it actually stops making thyroid hormone and you actually can drop into the hypothyroid phase. But then eventually people even out and most patients go back to normal thyroid function. But be careful for those ones that don't. They may need lifelong thyroid hormone, especially if they have TPO antibodies that are positive. They're much more likely to go on to need thyroid hormone. So thank you for listening. Hopefully you'll see you at Meds one of these days.